Hi, hope you're all doing good. So in this series of paper discussion videos, let's discuss various important topics which were dealt in NEET MDS 2020. Right? And if you have any additional information or additional keywords, do let me know in the comment section below. I'll be making videos accordingly. And also if you need any additional information apart from that being discussed in these videos, again do let me know in the comment section. I'll update the required information in the description part of each video. Right? So let's proceed with our discussion, starting with osteoradionecrosis. So we have discussed about osteoradionecrosis n number of times, but for sake of completion, let's discuss the same again. So as you can see, osteoradionecrosis, it is one of the most serious clinical complications that occurs in bone after irradiation. And the higher the radiation dose absorbed by the bone, especially more than 60 gray, the greater the risk for osteoradionecrosis. Consider this very, very important, right? And also, as you know, we have hypocellularity, hypovascularity and hypoxia, three important features of osteoradionecrosis. Now let's move on to the next question. So various formulae to calculate the dosage in child based on adult dosage. As you can see, we have several formula like Clark's rule or Clark's formula, Young's formula, Dilling's formula. So Clark's rule, the weight of the child in kgs by 150 into adult dose. Whereas the Young's formula, child dose is calculated by the following formula, age by age plus 12 into adult dose. Dilling's formula, age by 20 into adult dose. And also you can see based on age, based on ideal body weight, you can see the percentage of adult doses for the respective age groups, right? Now let's move on to the next question. Parkland formula, fluid resuscitation in case of burns patients. So this is a formula as you can see. So Parkland's formula, fluid resuscitation in burns patients, it's the simplest and the most widely used formula, that is Parkland formula. This calculates the fluid to be replaced in the first 24 hours by the following. Total percentage, that is total percentage body surface area multiplied by weight in kgs multiplied by 4, which gives us the volume that has to be resuscitated in the burns patient. So half of this volume is to be given in the first 8 hours and the second half is given in the subsequent 16 hours, which we discussed in our study club way back, right? So this is about Parkland's formula. Now also we discussed about PDL fibers, which antagonize or which prevent intrusion. So as you can see, we have a table depicting the functions and also the origin and insertion of various PDL fibers. So if you observe among this table, allular crest fibers, they resist tilting, intrusive, extrusive and rotational forces. And also we have oblique group of fibers which resist vertical and intrusive forces. And also you can see various other types of fibers, their origin, insertion, including their function. Consider this very, very important, right? Now let's move on to the next question. Histology cartilages. So there were several images, histologic images of various cartilages. So as you can see, we'll start with hyaline cartilage. So this is called as hyaline because of glassy-like appearance. So hylos in Greek means glassy. So it looks slightly basophilic overall in H&E sections, as you can see, and you can find chondrocytes in their lacunae. And then fibrocartilage, it's strongest as understood because of presence of fibers or dense collagen fibers which are oriented in direction of functional stresses. And also you can find chondrocytes in lacunae and thick bundles of collagen fibers. And then elastic cartilage, named because we can notice elastic fibers. So the chondrocytes are found in thread-like network of elastic fibers within the matrix, right? Now moving on to the next question. Angular defects. So we have 1-walled, 2-walled, 3-walled defects as you can see in the image. So 1, 2 and 3-walled vertical defects or angular defects. So these angular defects were classified by Goldman and Cohen on the basis of number of osseous walls. So these angular defects may have 1, 2 or 3 walls. So you can see image A, 3 bony walls, that is distal, lingual and facial, right? 3-walled defect, which means 3 walls are present. And then image B, you can see 2-wall defect, distal and lingual. And then image C, 1-wall defect, only distal wall is present, right? Very, very important. And also we discuss the same in our e-classes, study club discussions. You can find the images in our e-classes as well. Now, what is this 8q12 chromosome? So, almost in every exam there is one question mandatory. It's like as if it's a mandatory kind of question related to chromosomes, various pathologies implicating those particular chromosomes. So, this is a case of pleomorphic adenoma, as you can see. So, pleomorphic adenoma, it is a benign neoplasm consisting of cells exhibiting the ability to differentiate to epithelial cells, mesenchymal cells, and it has been suggested several names, as you can see in the literature. So, pleomorphic adenomas have shown consistent cytogenetic abnormalities, chiefly involving the chromosome region 12q13 to 15. The putative pleomorphic adenoma gene, that is PLAG1, has been mapped to chromosome 8q12, 8q12, right? Now, let's move on to the next question. Tetracycline, as you know, it has chelating property. So, if you review literature, tetracyclines have chelating property which form insoluble, unabsorbable complexes with calcium and other metals. As a consequence, milk, iron preparations, non-systemic antacids and sucralfate reduce their absorption. So, administration of these substances and tetracycline should be staggered if they cannot be avoided altogether. Staggering means allotting some time interval between the subsequent doses of different drugs, right? That is staggering. So, as you know, this tetracycline has chelating property, and you might have heard of the fact that milk, iron preparations and some of the preparations as mentioned in the literature should not be taken simultaneously with tetracyclines because they form insoluble, unabsorbable complexes, right? Now, let's move on to the next question. Physiology, Brunner's glands. As you can see the histologic image. So, Brunner's glands, in addition to intestinal glands, the first part of duodenum contains some mucous glands which are called as Brunner glands. So, these glands penetrate muscularis mucosa and extend up to the submucous coat of intestinal wall. So, Brunner glands open into the lumen of intestine directly, and Brunner glands secrete mucus and traces of enzymes. Now, moving on to the final part of this video, eruption timings, which we discussed in our study club n number of times. I think some of the images which we discussed are from Wheeler's, and I assume that the same images were given in the exam as well. So, eruption timings are always very important. It's better you memorize them, okay, especially those who are aspiring for 2021. So, as you can see, we have a chronology for primary dentition and permanent dentition. So, eruption timings are very important, and also you can find various stages of eruption in deciduous dentition and permanent dentition. It will be fun. Just try to memorize the values and try to correlate those with that of these illustrations. It will be fun learning different stages of eruption. So, it's like a quiz. It's like an interesting, challenging quiz. Like they'll be projecting you different teeth which are in different stages of eruption, and you need to guess the age of that particular patient. It will definitely be fun. Okay. So, these are some of the topics which I wanted to highlight in this video, and the intention here is to discuss those topics so that especially those who are aspiring for 2021 will have an advantage, will have an idea like what topics are covered in this exam, and those who have given this exam, those who have provided these keywords, you can analyze your key simultaneously, right? So, it's a win-win situation for everyone. So, wish you all the best, love you all, and as I mentioned, you need any further information, you have any additional keywords, topics, do let me know in the comment section. We'll update them accordingly. Wish you all the best, love you all.